California Task Force to study and develop reparation proposals for African Americans. Content warning. It contains discussions of racial discrimination, sexual assault, torture, lynching, and other forms of extreme violence. Contains unedited historical quotations and photographs of white supremacist hatred, torture, lynching, autopsy, and other forms of graphic violence.
And healthcare during slavery have stated that the institution of slavery has had a lasting legacy in the discriminatory healthcare system that would later emerge in the United States. 44 During the enslavement era, enslavers kept enslaved people in overcrowded, dilapidated living areas. Contributed to the spread of infectious and parasitic diseases. 45 Enslaved people were denied treatment in hospitals and access to mental health care. 46 Enslavers freely and openly tortured enslaved people, raped and abused women. Trafficked children with no legal consequence. 47 Physicians used enslaved people for dangerous experimental surgeries and procedures without repercussion. 48 Federal, state, and local governments used the law to further damage the health of enslaved people and dehumanize them. Electing to provide public health and healthcare services. 49 Dr. Carolyn Roberts stated during a hearing before the California Task Force to study and develop reparation proposals for African Americans that is a form of healthcare where medical violence against African and African-descended people became an acceptable, normative, and institutionalized practice. 50 of mental health patients were forcibly sterilized across California due to the eugenicist efforts of the Human Betterment Foundation. 1937, one of Nazi Germany's leading eugenicists wrote to Ezra S. Gosney, the financier who started the Human Betterment Foundation, saying, "You were so kind to send new information about the sterilization particulars in California. These practical experiences are also very valuable for us in Germany. For this I thank you." 409. Chapter 12. And Physical Harm and Neglect. Mental health. Slavery had disastrous health consequences for enslaved people due to lack of public health regulations and harsh working conditions that led to widespread infectious and nutritional diseases. 51 Infectious and parasitic diseases thrive in poor living conditions and overcrowding. 52 So among the major causes of illness and death for enslaved people. 53 Worm infections were common among enslaved people due to contact with polluted food and soil. 54 Hookworm infestation resulted in low birth weights and high infant mortality. 55 Contagious respiratory diseases were prevalent in months due to the overcrowded quarters and uninhabitable living conditions. 56 Malaria led to low birth weights and high infant mortality. 57 Lack of federal or state public health regulations resulted in contaminated food and water, non-existent sanitary facilities or sewage disposal, wastewater leakage, and poor garbage disposal, which contributed to diseases and infections that were more likely to affect enslaved people. 58 There was no government-funded health care or regulations regarding water treatment, sewage disposal, and the prevention of disease. 59 Sexually transmitted infections were major public health problems affecting the lives of enslaved people disproportionately due to forced breeding, overcrowded quarters, and lack of access to treatment. 60 Diseases, like pellagra, by a lack of nutrition in the diet, weakened the immune systems of enslaved people. 61 The health of enslaved people was worse than that of white people, because there were hardly any hospitals where they could be treated for disease. 62 With few exceptions, enslaved people and free black people were not allowed to access hospitals, almshouses, facilities for the deaf and blind. 63 The welfare of enslaved people was left to enslavers, while free black people were forced to fend for themselves. 64 In 1798, Congress established a loose network of marine hospitals to care for sick and disabled seamen. However, U.S. Treasury Department did not allow black sailors to be treated at these hospitals. 65. Enslavers tortured enslaved people openly, inflicting cruel punishment upon them without any legal consequences and often permanently damaged their health. 66. Enslavers deprived enslaved people of food and water, whipped them to inflict serious pain. Used them. 67. The brutal violence of enslavers and the harsh labor conditions they imposed resulted in branding, dog bites, assaults with fists and rods, burns, lacerations, mutilated body parts, and bone fractures for enslaved people. 68. From chains and iron restraints resulted in injuries, infections, and permanent disability for enslaved people. 69. Enslaved people were routinely murdered by white enslavers and white people who stabbed, shot, and whipped them to death with impunity. 70. The lack of protections from extreme climates to harsh laboring conditions resulted in illness, injury, and disease. 71. Mental health. First public mental hospital in the United States was founded in 1773, in Williamsburg, Virginia. 72. Eventually, a few public mental asylums opened in Maryland, Kentucky, and South Carolina during the antebellum period. 73. Initially, black patients were only admitted to the asylum in Williamsburg. The other public mental health institutions did not allow black patients to be admitted. 74. Their free black patients were funded the state at much lower rates than whites, so patients received less care and services. 75. Some enslaved people were diagnosed with fictitious mental illnesses. He further discussed in Section X of this chapter. 76. Numerous diseases that allegedly affected enslaved people were invented by Southern doctors, including drapetomania, the irrational desire to run away, and dysesthesia. Laziness that caused enslaved people to mishandle enslaver property. 77. Doctors recommended torturing enslaved people as treatment for these false diseases. 78. Generally, antebellum mental asylums were segregated or closed to black patients. 79. If admitted, black patients were housed in poorer accommodations and forced to work at the asylums under harsher conditions than white patients. 80. They were assigned the dirtiest and most difficult jobs, meal preparation, and handling the personal hygiene of ill patients. 81. In Central Lunatic Asylum, in Virginia, enslaved people were forced to labor, frequently on a plantation while being mechanically restrained. 82. In the North, local governments typically denied African Americans access to mental health care in asylums. 83. For mentally ill free African Americans in the North, poorhouse and the jail were the only social welfare institutions open to them in the antebellum era. 84. Free African Americans did work as janitors in northern mental hospitals and medical schools, but were not allowed to work as direct caregivers. 85. Consequently, people and free African Americans were deprived of adequate mental health care by federal and state governments during the slavery era. Women and children held unrestrained reproductive control over enslaved women using rape and livestock breeding techniques sanctioned by Law. 86. The enslaver, President Thomas Jefferson, wrote in his Journal of Plantation Management, "Consider a woman who brings a child every 2 years as more profitable than the best man of the farm hat she produces as an addition to the capital." 87. Jefferson was commenting on the enslavers' practice of using enslaved women to reproduce. Like livestock, enslavers used a variety of tactics to induce enslaved women to bear children, such as punishing and selling women who did not bear children, committing sexual assault, manipulating the marital choices of enslaved people, and forced breeding. 88. State laws stated that children who enslaved mothers and white men were legally considered to be enslaved, leading enslaved women to be vulnerable to sexual violence inflicted by white men. 89. Furthermore, state laws did not recognize the rape of enslaved women as a crime. 90. Slavers were legally allowed to economically profit from raping enslaved women because rape generated a larger workforce of enslaved people, and enslavers could rape freely. Consequence 91 White women married to enslavers often whipped and tortured enslaved women after they were sexually assaulted by white men. 92 Enslavers inflicted psychological and physical punishment on enslaved women if they did not bear children. 93 Enslavers forced enslaved men to submit to being raped by men and castrated enslaved men who were not fit for breeding. 94 of enslaved mothers and their babies was greatly damaged due to the treatment of enslaved women as objects to be raped, bred, or abused. 95 On average, enslaved women became mothers earlier than white women due to pressure to reproduce. 96 Enslavers treated enslaved women who did not bear children as damaged goods, pawning them off on other enslavers. 97 Southern courts even established rules for sellers of enslaved women who misrepresented their fertility, akin to rules governing the sale of commodities, i.e., using some sort of fine or consequence for misrepresenting their merchandise. 98 Mother-child bonding was shattered as white enslavers trafficked children for labor to other plantations or sold them. 99 Records show that expectant mothers only received work relief after the 5th month of pregnancy and returned to heavy labor within the first month of the infant's life. 100 Enslaved mothers were forced to labor in fields and to breastfeed white children, while neglecting their own. 101 and enslaved women were whipped routinely by white enslavers. 102 Enslavers dug holes in the ground, forced women to lie face down so that their stomachs would fit inside the holes, and whipped their backs. 103 Diseases that allegedly affected enslaved people were invented by Southern doctors, including drapetomania, the irrational desire to run away, and dysesthesia, a supposed laziness that caused enslaved people to mishandle enslaver property. Recommended torturing enslaved people as treatment for these false diseases. 411. Chapter 12. And physical harm and neglect. Done to punish enslaved women without damaging the fetus, which was legally considered to be the enslaver's future property. 104 Women became pregnant during winter months when labor was reduced, consequently giving birth during the summer, the time of highest labor demand and greatest sickness, leading to high infant mortality rates. 105 Enslaved women had rich cultural knowledge of natural birth control from their indigenous cultures. They were forced to conceal from enslavers. 106 Black midwives assisted pregnant enslaved women with inducing and hiding abortions. 107 Women born into slavery suffered from mortality rates that were double the free population, consumed contaminated and less nutritious food, experienced stunted growth and health problems throughout childhood. 108 2/3 of infants died within their first month of life, due in part to the hard labor enslaved mothers were forced to do. 109 Children were forced to work by the time they turned 7 or 8 years old. 110 Experimentation neglected to protect the health and safety rights of enslaved people, who were rendered legally invisible under the institution. Slavery. 111 In many hiring contracts concerning enslaved people, references to medical care of enslaved people were omitted. 112 In legal disputes concerning enslaved people hired out to others, courts ruled that the hirers need not provide medical care to the enslaved people. 113 Because enslavers wished to avoid paying medical expenses, enslavers often only called physicians as a last resort. When the enslaved person was nearly dead. 114 Physicians actively exploited enslaved people, practicing dangerous experimental procedures on them and using their cadavers for dissection without consent. 115 Southern doctors were hired by enslavers and insurance companies to accurately determine the market value of black bodies. 116 physicians used slavery for economic security and experimented on black people using dangerous procedures that harmed them. Furthered the physician's professional advancement. 117 black bodies filled dissecting tables, operating theaters, and experimental facilities. 118 An enslaved person named Sam was experimented on by multiple doctors. He had his lower jaw bone removed without anesthesia for medical research. 119 Marion Sims, the founder of modern gynecology, and an enslaver, experimented upon enslaved women and performed vaginal surgeries upon them against their will. 120 Sims used enslaved women's bodies to perfect surgical instruments and advance his professional status. 121 Sims' enslaved patients worked as his enslaved nurses and surgical assistants. Though they did not receive recognition for doing so. 122 After being experimented upon by Sims, the enslaved patients were returned to their enslavers. 123 After it was perfected through medical experimentation upon enslaved women, received numerous invitations to perform the vaginal procedure for European royalty. 124 People were used to test experimental caesarean sections and vaccines. 125 Surgeons often used enslaved people for surgical experiments and experimentation in and dosages. 126 Enslaved people's bodies were dissected after death to advance medical knowledge, and their remains were found at Virginia Commonwealth University in 1994. Findings such as these have occurred in numerous medical schools across the country. 127 California. The period of enslavement. White Southerners flocked to California with hundreds of enslaved black people when the gold rush began in 1848, forcing them to toil in gold mines and hiring them to cook, serve, and perform manual labor. 128 Some enslaved people were forced to work in the gold fields to make money for their enslavers. Died illness, and if they could not do so, would lose their chance at freedom. 129 Black newspapers described brawls between enslaved people and white enslavers across California. 130 1851 The U.S. Congress created a U.S. Marine Hospital in San Francisco, which was completed in 1853. 131 Marine hospitals were set up to care for sick and disabled seamen by the U.S. Treasury Department. 132 The U.S. Treasury Department distributed strict guidelines specifying that the Negro slaves could not receive treatment at these. 133 African Americans were relegated to the segregated sections of state hospitals in San Francisco and Sacramento. 134 In the 1850s, Biddy Mason moved to California with her enslaver. 135 She lived for 5 years in California as an enslaved woman, until she challenged her enslaver. Freedom in court. 136 She later became a midwife and nurse, running her own midwifery business and saving enough money to purchase land and establish a church. 137 She donated to many charities, helped feed and shelter the poor, and founded an elementary school for black children. 138 Marion Sims, the founder of modern gynecology, and an enslaver, experimented upon enslaved women and performed vaginal surgery upon them against their will. Enslaved women's bodies to perfect surgical instruments and advance his professional status. 112 In physical harm and neglect.